Hello, I'm Joan. I'm 85 and I live with my cat Fluff and Shirley. I've got 3 lovely children, but they've all moved away from Southampton now. I'm not as mobile as I used to be and walk with a stick, but still do my shopping and cooking and want to be as independent as I can for as long as possible. I try to keep my mind and body active by volunteering for a local charity which gets me out and about and makes me feel part of the community. I'm more unsteady on my feet these days and fell over in the street recently, which was a shock, I can tell you. Luckily, nothing was broken, and after the doctors and nurses at the hospital checked me over, they referred me to a new integrated community team and I was able to go home. Before I left, the nurse gave me leaflets on preventing falls and advice about keeping well. It made me think and I decided to join a local exercise class. When it came to November, I got a bad cough, but soldiered on thinking it would clear up in a few days. I couldn't get rid of it though and started to feel more breathless, generally poorly and just plain worn out. My doctor's surgery said I was a priority as I'm over 75 and had been ill recently. So I got to see the GP quickly, which was good as I was anxious. A volunteer from a local charity who I met through the integrated team took me to the doctor. He said I had a chest infection and was at risk of developing pneumonia. We agreed some support at home for a while would be useful, and the GP referred me back to the integrated team with staff from health, social care, housing and voluntary groups all working together. I was so relieved that I didn't have to go to hospital and could stay at home with Fluff. The integrated team decided who was the best person to visit me at home, and a community nurse came to see me twice during the next couple of days. She checked how I was doing with the antibiotics I'd been prescribed and kept a close eye on my general health, which was very reassuring. I was soon back on my feet and had a bit more confidence. I've started to attend a local knit and natter group that the nurse told me about, which is a bit of a giggle. The volunteer introduced me to a new friend who lives nearby, and we meet up every week for coffee and to do some shopping. It's lovely as we can now look out for one another.
You can read about our plans to join up your care by visiting our websites. Find out more and have your say.